Thank you so much for choosing North Central Surgical Hospital for your joint replacement surgery and care. We would first like to wish you well with your upcoming procedure and inform you that we have put together a short video that will help you to know what to expect before, during, and following your surgery. We encourage you to have a family member watch this video with you to help facilitate your recovery. There will be contact information toward the end of the presentation, so you might want to have a pen and paper available for notes. In this video presentation, we will be discussing where to come and go on the day of your surgery. We will introduce you to our excellent staff and discuss our joint wellness program. We will be talking about your home medications as well as what you can expect during your stay with us, such as how to take excellent care of yourself to prevent blood clots from forming. We will discuss nutrition plans, physical therapy, and lastly, we will give you a list of some of the different equipment that may aid you in your recovery. In preparation for your surgery, you will be asked to either schedule an appointment with the pre-admission testing clinic or you will receive a phone call for a pre-op medical history review. The phone interview may take up to 45 minutes. You can expect a call regarding insurance verification, and you may also receive a call from your anesthesiologist the evening prior to your surgery. We are relatively easy to find on the west side of Central Expressway or Highway 75 between Walnut Hill and Park Lanes in the convenient North Park Mall area of Dallas. From the north, exit 75 and cross Walnut Hill Lane, move to the far right lane. Look for the two-towered white building with the sign labeled North Central Medical Plaza and turn into the parking lot. From the south, U-turn at Walnut Hill Lane and move to the far right lane. In either case, once you make the turn into our parking area, drive under the overhang where our friendly valet is on staff to quickly and efficiently take care of your vehicle. Valet is complimentary with ticket validation, and you may also self-park on the surface lot or in the parking garage. After you've parked and entered the building through any of the sliding glass doors along the front or rear of the building, make your way northward to Tower 1. Walk through the elevator lobby to the back of the building for registration in Suite 100. Once you have checked in, you will be called back to the preoperative area where a member of the nursing staff will help you change into a gown, check your weight, ask about your medical history, sign consents, start your IV, give you any pre-op medications that have been ordered, and safely lock away any personal belongings. You will be visited by your surgeon, anesthesiologist, and OR nurse. And your family will be allowed to come back and stay with you until you're ready to be transported to the operating room. After your surgery, you will be transferred to the recovery room where your nursing staff will assess your pain, breathing, and alertness. You can expect to be in recovery between 1 and 2 hours. After recovery, you will be moved to your room on the second floor. Post-surgical unit. All rooms are private and are furnished with an armchair, patient bed, and side chairs for extra guests. Each room is individually temperature controlled and we provide free Wi-Fi, so feel free to bring cell phones, laptops, and tablets. During your stay with us, you will meet many staff members, including registered nurses, patient care techs, case managers, and physical therapists. You may also meet staff from radiology, pharmacy, lab, surgery, pre-op, and recovery. You can tell the area our staff works in by the color scrubs or uniform they are wearing. As part of our joint wellness program, we would like to emphasize that you are a well patient. The only difference between the day before surgery and the day after is that you have a new joint. The average length of stay is between 1 and 3 days, and the registered nurse or physical therapist will assist you to get out of bed and walk with a two-wheeled walker on your surgery day. Expect to be seen for a full physical therapy evaluation within 24 hours after surgery. Over the next day or days until you are released from the hospital, your care team will work with you to increase your out-of-bed activities and assist you in dressing and using the restroom safely with your new joint. A staff member will deliver a menu to your room and help you select your meals. We can accommodate allergies and preferences, and the dietitian is available to help you as needed. Our goal is to give you very good care. You will need to bring your home medications on the day of surgery in their original pharmacy containers. Make an accurate list of medications you take at home, including prescriptions, over-the-counter medicines, and nutritional herbs and vitamins. Report all drug allergies such as rash, hives, and swelling, or unexpected reactions to medications. We use several methods for blood clot prevention, including early movement and rehabilitation, and mechanical methods such as intermittent compression and ankle pump exercises. You may also receive a medication such as aspirin, Coumadin, Xarelto, Eliquis, or Lovenox. Graduated compression or TED hose may be used for swelling control. Some discomfort is to be expected, but it shouldn't be excruciating. To measure your pain, we will ask you for a number between 0 and 10. As you can see on the scale, 0 is no pain and 10 is the worst pain you can imagine. If you are unable to give us a number, we may ask you to use the faces as a guide. During surgery, you will receive anesthesia and also a local numbing medicine inside the incision. Expect your new joint to be relatively comfortable while this numbing medicine is active. To manage your pain in the days to come, your physician will order pain medication. You may have pills to take orally or medicine your nurse can administer through your IV. There are both advantages and disadvantages to different medications that your nurse or physician will be happy to discuss with you. Understanding your medications will help set realistic expectations, optimize your pain management experience, and may lessen the need for narcotics. Your nurse will provide you with and instruct you in the use of an incentive spirometer. This device will help keep your lungs healthy following your surgery. As part of our fall prevention program, you will wear a gait belt when up and out of bed. You will be given an armband and non-slip socks. You may notice the sign inside your room that says, "Call, don't fall." Please call us to get out of bed. Your physician believes healing at home is best, and we will make every effort to ensure you are able to safely return to your home after surgery. For safety at home, use of a walker is recommended. Move rugs, clear pathways, and watch out for items or pets that can trip you. You may want to purchase a bag for your walker to hold frequently used items to keep them close by. You can get a handicapped parking application from the doctor's office, but you will need to take the completed application to the DMV to get a placard. Identify a family member or friend to be your joint replacement coach or support person prior to your surgery. Your first physical therapy session will be in your room the afternoon of the surgery or the morning after. During your evaluation, you can expect to do bed exercises, walk with a rolling walker to your tolerance, and return to bed. Your physical therapist will also discuss your equipment needs for your return home. The following sessions will increase your walking distance, exercise, work on getting in and out of bed, and practice the use of stairs and a curb. You will get to sit up in the chair in your room. If you need instruction for dressing or bathroom safety, the therapist can continue to work with you until you are independent or have the tools you need to dress and complete your toileting safely. To discharge home from North Central Surgical Hospital, you need to reach a few goals. You must be able to get in and out of bed without assistance, walk 150 feet with your walker, safely walk up and down stairs and one curb, be independent with your home exercise program, and understand or demonstrate applicable precautions for bathroom transfers, dressing, and all other activities. If you already have a walker, please bring it with you to be checked for safety and height adjustment. If you do not have one, we will issue one to you. Durable medical equipment is either partially or totally covered by your insurance or Medicare plan. A 3-in-1 commode may also be covered by insurance. Other equipment can be purchased from durable medical equipment companies or retail stores. We can provide a list of these companies to you. Once you are admitted to our hospital, our dedicated case managers will assist in setting up your continued care for after you are discharged from North Central. Our commitment is to provide you with the most medically appropriate level of care to support your recovery. These options may include going home with outpatient therapy, going home with home health care, or any other medically necessary level of care your physician deems is appropriate for you. For many, successful recovery at home will occur within 1 to 2 weeks. These are some commonly asked questions after joint replacement surgery. Will I need help when I get home? You will be able to move yourself around and take care of yourself, but will need help getting meals prepared, doing laundry, and performing other household tasks. You should arrange for postoperative help at home prior to your surgery. How long until I can drive? You must be off pain medication, and it will also depend on the site of your surgery. Ultimately, your surgeon will release you to drive. How long do I have to do the exercise program? This will vary depending on your surgery. Your doctor and physical therapist will assist in this decision. What shoes do I need? You won't need shoes while in the hospital. You may wear hospital-issued non-slip gripper socks. For return home, please bring a pair of lightweight tennis shoes or any flat shoes that are closed around the heel. Your physician may give you a card to present to airport security, but expect your joint replacement to be verified whether you present the card or not. Also, preventative antibiotics prior to seeing the dentist may be recommended. Please refer to your physician's office with any further questions regarding your implants and metal detectors or other long-term care changes for your new joint. If you have any questions or concerns, our caring staff will be happy to assist you. Thank you for letting us serve you, and thank you for choosing North Central Surgical Hospital.